Thank you for inviting me. It's brilliant to be here and to see so many faces as well. Um, Obviously, under difficult circumstances for people from our group, we have been struggling, we continue to struggle, but hopefully there are things that we have learnt through this time that can be useful to everyone. And we would really like to sort of share that information that we've learnt. And we've been very sort of careful to pay attention to sort of scientific advances over time. And whilst there haven't been it hasn't been anything sort of major but there may be some things that you may not have picked up that hopefully we can share with you. I'm going to try and screen share, so let me just give me a second. Okay, so this is our group. We were founded sort of, early on in the pandemic, and when we started, we were very much related to issues that started in schools, because whilst clinically extremely vulnerable people were shielded, unfortunately, in fact, they weren't shielded at that point, but unfortunately there weren't protections in place in schools. Schools were reopening and we had lots of concerns around those issues. And so we started supporting people, sharing the information that we had, and hopefully sort of helping people to make informed decisions on risks, and returning to school more safely, or for some it was too unsafe and it still remains too unsafe, and they are no longer in school, unfortunately, and are homeschooling, but they had to make the decisions right for them. And everyone has their own risk, everyone has their own risk tolerance, and it's really important that they obviously are able to make the right decision for themselves. So right, so how do we reduce our risks posed by COVID-19? So obviously the government had their own messaging on this: hands, face, space, and later on they mentioned fresh air, although I'm not sure many people got that message. We know these things already. Clean hands, well, okay, it's an airborne virus, but we have no objections to cleaning hands, and we really should. You can still spread it that way, but not very effectively. They called it face coverings. We weren't so happy about face coverings as in terms of terminology. We'll come on to that. Social distancing. These days, well, you're not going to be social distancing, and it's really difficult. And then fresh air, well, we're happy with that as well. So let's kind of move on. So there are many layers of protection when we're looking at this kind of this pandemic that we're trying to manage. And so you may have seen the Swiss cheese model before. It points to all these different things you can do: physical distancing, masks, hand hygiene, avoiding touching your face, trying to limit time in crowded spaces, fast and sensitive testing and tracing. Obviously, we don't have that anymore, but we do have lateral flows still. Ventilation, government messaging, again, wasn't really very helpful, still isn't. There's not much available anymore. Quarantine and isolation, there's no government support for that, really. I'm sure Stephen will get onto that later. And vaccines, which we hope you've all had. Obviously, face coverings. Face coverings could mean anything. It could mean scarves, it could mean neckerchiefs, it could be something homemade. And some of them were more effective than others. We would encourage people to consider higher quality, high grade PPE masks, FFP2 or FFP3. You can see a picture of myself and Kathy wearing FFP3 masks at the COVID inquiry, which we're sort of currently involved in. Another thing we've learnt about is there are mouthwash which have been shown to reduce the spread of sort of infections. If you are infected, potentially you could reduce it by killing off some of the virus that's present in your mouth. Obviously, it's within your whole body, but you might be able to reduce some of those risks. We've also looked into nasal sprays. Now, nasal sprays, again, it's about sort of protecting those mucosal surfaces. So you can trap the viruses to some extent. Obviously, it's not 100%. It is something that can reduce your risk potentially. So, we've got various different options here. Virales will trap viruses according to their information. Vicks First Defense, well, it reduces infection length. So if you were infected, some of them will do both of those things. So they can trap and also they can reduce infection length. Boots dual defense is quite a good one in that it works from quite young ages. You can use it from age 1+, pregnancy and breastfeeding, and so this is something that you can do in addition to, and we wouldn't say that would encourage people to not mask, especially if they're high risk. But if you're not masking for other reasons, then this is something that you could potentially do that might reduce your risk. There's something called a Novid that we're really keen to see coming into the UK. It is in various other countries right now. It's not available. It actually has safe active ingredients. It's nitric oxide, which is actually used in PICUs, but for a different purpose. So we know that it's incredibly safe, but is it effective? And there are trials ongoing for that, and so they're in phase 3 trials currently, but we don't seem to be any kind of progress. But various countries have accepted this as a means, and like I said, we would like to see it coming over here, because the data actually looks really good from what we have seen from this early data. So when you can't mask, obviously you mentioned nasal sprays. If you're in a dentist, this is something you might consider. Now, they're not very efficacious. They're not very good necessarily in comparison to wearing a mask. You can see 25 to 90%. There's a huge variability there. We've only really just been learning about these in our group. This is sort of something that we're intrigued by. I think it's probably down to fit is my best guess on that. So maybe if you're wearing it with a better fit, you might get a better barrier there. But obviously, it's about breathing purely through your nose, which is very difficult. So if you've got your mouth open, I'm not sure how effective it would really be, but it is something. So it's something that it might be worth considering. Right, so clean air. Cleaning the air, we think is really important, and we'd like to see it everywhere. We would like to see it in businesses, we would like to see it in workplaces, we would like to see it in schools, in hospitals, in all healthcare. We want to see it everywhere, and we don't really see any massive disadvantages to clean air. You can look up on this website, Clean Air Stars, to find out about the right air filters for your space. So you have to consider various factors. You have to consider room volume, you have to consider occupancy. It's quite a technical area, but this can help you to determine what is the right HEPA filter for your space, for your the amount of money that you have available to put into that. And so, we would encourage ventilation, we would encourage air filtration. Ventilation in newer buildings can be very good. Good air circulation from outdoor air, clean air coming in, although it might not be clean, it could be polluted, but that's another issue. Obviously, outdoor spaces, we like open windows, mechanical ventilation, air filtration, all really good. So, okay, clean air, what do we need to know? So, CO2 is used as a proxy for risk. It basically tells you how much rebreathed air there is in a space. I mean, if you look in that second column where it says the percentages, if we're reading the thing over 1,000 parts per million of CO2, the percentage of rebreathed air is 1.47%, so about 1.5. And if you go down to about 800, then it's about 1%. It's a non-linear relationship, so it kind of starts to shoot up as you get up to these higher levels of parts per million in terms of risk. But we use it as a proxy for our risk, so we can see which spaces are safer. And you can get CO2 monitors that you can bring with you. They're quite small. I'll show you one once I'm sort of back on camera. They're quite small. You can carry it in your bag, and you can have an idea of what the risk is in the different spaces. So the risk changes. If you have air filtration in the room, it's a different risk to if you don't have HEPA air filtration in the room. If you do have HEPA, then the reason it changes is because CO2 is not removed via HEPA air filter, but it can make a higher level still sort of safer for people to be in that room. So, you know, we would hope to see sort of under 800 parts per million, ideally, and obviously the risk increase as you increase the CO2 content and the rebreathed air in the space. Obviously, it's also related to prevalence. So the more people who are infected at a particular time will increase your risk. So these are some different types of air filters that you might want to buy, something that you're considering. They can be really cheap. Okay, so they can be around about £100, £150. You can buy them for your homes, you can buy them for your office. They're going to have really good advantages for your workplace. If you encourage your employer, once Stephen gets on to talking about the pledge, encourage your employer to look at these risks and consider, is it an advantage for them to have these in their workplaces? And I would say that they very much are, because staff absences should reduce. If you're reducing airborne infections, you're reducing risk. You're also reducing hay fever and allergies, pollen. It's good for asthma and lung conditions. It's just generally good for health. So we encourage people to consider these. You can also get mini HEPA filters to take with you, personal HEPA filters on the go. Now, it's not the same as having like the whole room air cleaned. It's only pointing air directly at you. And if you can see this image, which is pointing to little bits of arrows that are kind of pointing into the middle there, this is called entrainment. So it's sucking the air from the outside, the dirty air, in around the edges as well. So it's not as good as having sort of a big HEPA filter cleaning the air. You know, there's still a small risk potentially, and HEPAs aren't 100% anyway, but it is still better. So HEPA air filters, small HEPA air filters, still are beneficial. You can make your own ones. Sorry, I didn't show you on the last one. You can make Corsi Rosenthal boxes. You can look them up. Tape, air filters, fan. That's all a HEPA filter really is. It's a fan and a filter. You can tape them up, make your own. You need to make sure there are no gaps. If there are any gaps, then it's not going to work properly. But yeah, you can make your own mini ones as well, if you are so inclined. So these are the things that we would like to suggest for people. Outdoors is great. Meet your friends outdoors where you can. Your risks will be much lower. Indoors, if you're indoors, particularly if you're high risk, you really should be considering masking. But I think that everybody should be masking really still. You know, cases are still high, people are still getting infected. And, you know, if you want to support other people, which I hope you do, then, you know, that's another good reason, not just to protect yourself, but to protect other people too. FFP2 and FFP3, nasal spray, mouthwash can be used as additional layers if you want to. Lateral flows, arrange to test with your friends before you meet up. Monitor your risk, carry your CO2 monitor, keep an eye on how the CO2 goes up in that space, and limit the amount of time in a space if it's crowded. I mean, we tend to avoid things like tiny spaces like lifts are particularly high risk, but you know, you can take the stairs. You can't always take the stairs, but if you can't, then obviously those other things will protect you and reduce your risks. If there's an infection in your home, this is quite important. You really need to try and consider how to reduce the spread. And actually, our group has been very effective at reducing spread in homes, despite increasingly transmissible variants. You know, we have managed to contain infections. It's very difficult when you've got small children. Small children present their own risks. Obviously, if the small child themselves is sick, you know, you have to consider how you're going to manage that. And so, you know, older children very often more than happy to sit on the computer all day, you know, and they will sort of stay in their room and not really cause too much bother. They can wear masks going in and out of the rooms, put them on themselves. But, you know, so isolating is really important if you can. Ventilating, wearing those masks, using all those other protections like nasal spray and mouthwash. and try not to sort of share towels and things. Try and use a different bathroom if you can, and regular testing. Test twice to negative is still a good way of managing that risk. So